What is optic neuritis and how was it understood historically? Imagine suddenly losing vision in one or experiencing sharp pain when moving your. These are common signs of optic neuritis, an inflammation of the nerve that carries visual signals from the eye to the brain. This nerve is called the optic nerve, and when it becomes inflamed, it can cause a range of vision problems. The severity can vary from mild blurring to complete blindness in the affected. Usually, it affects just one, but sometimes both eyes can be involved. Optic neuritis is often linked to autoimmune conditions, where the immune system mistakenly attacks the body's own tissues. The most well-known association is with multiple sclerosis, a disease that damages the protective covering of nerve fibers in the central nervous system. In multiple sclerosis, the immune system targets the myelin sheath around nerve fibers, and the optic nerve is no exception. Besides multiple sclerosis, infections caused by viruses, bacteria, fungi, or parasites can also lead to optic neuritis. Rarely, toxins or certain medications might be involved. People with optic neuritis usually notice sudden vision loss, eye pain that worsens with movement, and a reduction in color perception. Some might see flashing lights or notice that their pupils respond differently. An interesting phenomenon called Hof's phenomenon occurs when increased body temperature, like during exercise or a hot bath, temporarily worsens vision. Diagnosing optic neuritis involves a thorough exam, tests of visual acuity and fields, color vision tests, and imaging techniques like magnetic resonance imaging. MRI scans are especially helpful because they can show inflammation of the optic nerve and reveal lesions in the brain associated with multiple sclerosis. Optical coherence tomography, a special imaging test, can measure damage to the nerve fibers of the optic nerve, providing valuable information about the extent of injury. Looking back in history, doctors initially recognized optic neuritis mainly through symptoms like sudden vision loss and eye pain. Early medical descriptions noted inflammation of the optic nerve as a cause of vision problems, but understanding was limited because imaging technology was not available. As knowledge of autoimmune diseases like multiple sclerosis grew, doctors began to see optic neuritis as often a sign of these systemic conditions. The development of magnetic resonance imaging in the late 20th century transformed how we diagnose and understand this condition. MRI allowed physicians to visualize inflammation and demyelination in the optic nerve and brain, firmly linking optic neuritis to multiple sclerosis and other neurological disorders. Today, we know that optic neuritis is an inflammatory condition that causes vision loss and pain, often connected to autoimmune diseases. Our understanding has evolved from simply recognizing symptoms to appreciating the complex immune and neurological processes involved. Modern imaging techniques have played a crucial role in this progress, helping doctors diagnose accurately and tailor treatments. Recognizing optic neuritis is important not only for protecting vision but also for identifying underlying systemic conditions. If you experience sudden vision changes or eye pain, it is essential to consult a healthcare professional promptly for proper diagnosis and care.